How do assisted reproductive technologies, ART, cause multiple pregnancies? Imagine a couple trying to have a baby and exploring options to make it happen. Assisted reproductive technologies are often part of that journey, but they can sometimes lead to more than one baby at a time. Let's look at how that happens. In procedures like in vitro fertilization, or IVF, doctors usually transfer more than one embryo into the woman's uterus. This is done to increase the chances that at least one embryo will implant and grow. Sometimes, 2 or more embryos are transferred, which naturally raises the possibility of twins, triplets, or even more babies. Another factor is ovarian stimulation. During ART, women often take medications to produce multiple eggs at once. These drugs cause the ovaries to develop several follicles, each containing an egg. When these eggs are fertilized, there are more embryos available to transfer or freeze for later use. The more eggs released, the higher the chance of multiple pregnancies. The quality of the embryos and the woman's age also play roles. Younger women with high-quality embryos tend to have higher success rates, so transferring multiple embryos can lead to more than one pregnancy. Fertilization rates are higher with good quality eggs, which increases the odds of multiple embryos successfully implanting. Clinics and patients sometimes decide to transfer more than one embryo because of financial reasons, limited insurance coverage, or a desire to get pregnant faster. In some countries, regulations limit the number of embryos transferred, but practices vary. To reduce the risk of multiple pregnancies, doctors often recommend transferring just one embryo, especially in younger women with good prospects. This is called single embryo transfer. Monitoring the ovaries during stimulation helps prevent too many follicles from developing, which can lead to high-order multiples. If multiple babies are born, sometimes doctors discuss options like multifetal pregnancy reduction to improve health outcomes. From a family planning point of view, multiple pregnancies can carry risks like preterm birth, low birth weight, and complications such as preeclampsia. That's why careful counseling and planning are important before starting ART treatments. Understanding these factors helps couples make informed choices about their reproductive options and the potential outcomes. So, in simple terms, ART causes multiple pregnancies mainly because of the practice of transferring several embryos and stimulating the ovaries to produce multiple eggs. By following guidelines and making thoughtful decisions, doctors aim to balance the chance of pregnancy with the health and safety of both mother and babies.